Well, hello. Thank you so much for joining me. For those who are not familiar with you and the work you've done, do you mind just quickly introducing yourself?
Why, of course. And thank you for chatting. My name is Chiquita Brooks-LaSure, and I am the former Center for Medicare and Medicaid Services, the administrator of that agency. It is a $1.4 trillion agency. We run the Medicare, Medicaid, and the Affordable Care Act marketplaces, as well as uh, really oversee the health and safety of tens of thousands of facilities across the country, like hospitals, nursing homes, and dialysis centers.
Amazing. Thank you for the work that you've done.
Thank you.
I find that in my community, I mostly speak to working parents. They're not quite familiar with what all of this entails. And so for parents maybe who are not familiar with the intricacies of all of these different programs,
True.
what kinds of services does Medicaid actually cover, specifically as it pertains maybe to kids and families?
So Medicaid and CHIP are one of the most important programs in this country for women and for families. And I'll say particularly, I think the Medicaid program has grown over the last decade and helps both low-income families, working families, but particularly the middle class. And just to give you a couple of examples, Medicaid pays for almost half of the births in this country. So in some states, it's even more than that. But many of the children that are born in this country are born under the Medicaid program. So it is incredibly helpful and important for maternal health, for infant health, and certainly for children. And then more specifically about kids, about half of the kids in this country are covered by Medicaid and CHIP. And Medicaid is very comprehensive in its coverage and particularly takes care of high needs kids. So if you're a child who needs to be in a children's hospital, for example, if you're born with birth defects or issues, it's usually Medicaid that's the one taking care of you. If you have cystic fibrosis, if you have something like sickle cell, it's usually Medicaid. And increasingly, if you have autism, if you are on the spectrum, if you have developmental disabilities, Medicaid is the program that is supporting your family, especially if you're in the middle class.
Yeah, thank you so much. I was going to just ask you, how does it support families in those early stages of life? And you've covered that. But what role does Medicaid specifically play as it pertains to infants and toddlers with developmental delays or disabilities? It's something that I talk a little bit about. My two oldest were in EI when they were younger, when they were in foster care. And my biological children have also benefited from EI. And I think a lot of people don't understand how connected all of these things are. And so do you mind explaining that a little bit, kind of how those services are connected?
Sure. There's in the alphabet soup of government programs, there's this term called EPSDT. What that means is basically, if you're a kid, we will screen you. We will figure out what services you need. And it is the responsibility of the Medicaid program to pay for those services, to screen you, to do diagnoses, and to give you treatment. And what that means is that for a lot of children in this country, when they need additional services, Medicaid is the one that pays for them. And again, the screening part is so important to find out, what do you need? So if you are on Medicaid, you can go to your doctor, to your primary care physician, and do those screenings. Certainly, if you're born with severe issues, the hospital, other providers are going to know that Medicaid might be something that you need to support. It supports even increasingly services in the schools, and that's something that we in the Biden-Harris administration really tried to encourage and push. After COVID-19, we saw a spike in mental health issues among our children. I had a child who was in kindergarten when I know all of us moms have blocked out.
Yeah, that's a dark time.
It's very dark, right? Trying to figure out how to occupy children and we all of a sudden had to have them at home. And we've seen a spike in mental health needs in our kids. And a lot of times it is Medicaid. Medicaid is the primary payer of mental health services, and particularly for children.
And that spans across all ages, right? Throughout elementary all the way up until high school and beyond that? Or does it stop kind of at those high school years?
So there is particular protection for children under the age of 18, where Medicaid is extremely comprehensive in terms of all those services. But that's why it's important that we have people in our country covered no matter what age they are. And that is a big part of the work of the Affordable Care Act, to make sure that when you are, if your income rises or you get older, that you have somewhere to go. So if you do not have employer-sponsored insurance from your family's job, then you can enroll in the Affordable Care Act. One of the big things that we did as part of the Affordable Care Act, it was part of the Obama administration and on the Hill working on the ACA, was to let kids be covered, young adults be covered until they were age 26 and their parents' coverage. And that's really key to making sure that you can live a healthy life, to have health insurance, no matter, I say, whatever the M is.
Well, and I think increasingly more often than not, kids are leaving college and maybe don't have a career path that's offering them health insurance for a bit of time. And so being able to be on that health insurance under your parents until you're 26 is actually game-changing for those. I call them kids, I guess.
Exactly.
20-year-olds.
No, yes.
But for those young adults to have access to that is something that I think we often forget is part of this conversation.
Absolutely. And I personally continue to think it's really important to the economy. Just to give you one example, I had a babysitter who was in school for to be a counselor. What we need, right? More mental health professionals. And when she graduated, she was just starting to get clients, and she talked to me about how do I enroll in coverage, and I talked to her about Medicaid and the Affordable Care Act. And we want someone like her to go ahead and go into the workforce. And sometimes if you're on your own, you're not going to be offered insurance.
Yeah. And so you've mentioned mental health within schools and coverage for that, but what other services might be covered under Medicaid as it pertains to school-age children?
Certainly, mental health is a big part of it. Again, developmental disabilities. So all of the additional services that you might need to really help and make sure that you can develop in the way you need. And one of those is home and communities-based services. So Medicaid is the primary way that if you need, say, an aide in your house to keep you out of the institution, Medicaid is the payer who pays for some of those services. So that's kind of more in the developmental space, but certainly things like organ transplants. Medicaid is the primary payer for the organs that young babies get when they need to, if they need additional organs or treatments. As these exciting, innovative drugs come to market, it's often Medicaid who is helping families pay for those potential cures and those treatments that would bankrupt any family trying to pay for them.
And, I think, as I said at the beginning of this, a lot of people don't understand what is covered under all of this. But I think even more so than that, many parents aren't sure if they qualify for Medicaid or they feel intimidated by the process, whether it's for themselves or for children. And so what advice would you maybe give to families that are unsure whether or not it's something that they have access to or can kind of pursue?
I would encourage everyone to talk to someone who can help walk them through the process to find out if they're eligible. It does vary by state what the eligibility is, but you can go to any state website. You can always go to healthcare.gov. And while it may not be that healthcare.gov is for you, they can route you to the right coverage, whether it's Medicaid in your state or Affordable Care Act coverage. It's a great place to start.
Amazing. Well, thank you so much for all of this. I think it's incredibly helpful for parents just to better understand what is available, what it covers, and how if they are wondering whether or not they're qualified, they can kind of find that information.
Thank you.
Thank you.